Welcome dear one, so before you watch this video please don't forget to subscribe in our channel Psychological Solutions, and I hope that you will to like it, to share it with your friends. What is depression? Everyone occasionally feels blue or sad, but these feelings are usually fleeting and pass within a couple of days. When a person has a depressive disorder, it interferes with daily life, normal functioning, and causes pain for both the person with the disorder and those who care about him or her. Depression is a common but serious illness, and most who experience it need treatment to get better. Many people with a depressive illness never seek treatment. But the vast majority, even those with the most severe depression, can get better with treatment. Intensive research into the illness has resulted in the development of medications, psychotherapies, and other methods to treat people with this disabling disorder. What are the different forms of depression? There are several forms of depressive disorders. The most common are major depressive disorder and dysthymic disorder. One major depressive disorder, also called major depression, is characterized by a combination of symptoms that interfere with a person's ability to work, sleep, study, eat, and enjoy one's pleasurable activities. Major depression is disabling and prevents a person from functioning normally. An episode of major depression may occur only once in a person's lifetime, but more often, it recurs throughout a person's life. Dysthymic disorder, also called dysthymia, is characterized by long-term 2 years or longer, but less severe symptoms that may not disable a person but can prevent one from functioning normally or feeling well. People with dysthymia may also experience one or more episodes of major depression during their lifetimes. Some forms of depressive disorder exhibit slightly different characteristics than those described above, or they may develop under unique circumstances. However, not all scientists agree on how to characterize and define these forms of depression. They include 3. Psychotic depression, which occurs when a severe depressive illness is accompanied by some form of psychosis, such as a break with reality, hallucinations, and delusions. 4. Postpartum depression, which is diagnosed if a new mother develops a major depressive episode within 1 month after delivery. It is estimated that 10 to 15% of women experience postpartum depression after giving birth. Seasonal affective disorder, SAD, which is characterized by the onset of a depressive illness during the winter months, when there is less natural sunlight. The depression generally lifts during spring and summer. SAD may be effectively treated with light therapy, but nearly half of those with SAD do not respond to light therapy alone. Antidepressant medication and psychotherapy can reduce SAD symptoms, either alone or in combination with light therapy. Depression National Institute of Mental Health. What are the symptoms of depression? People with depressive illnesses do not all experience the same symptoms. The severity, frequency, and duration of symptoms will vary depending on the individual and his or her particular illness. Symptoms: persistent sad, anxious or empty feelings of hopelessness and or pessimism, feelings of guilt, worthlessness and or helplessness, irritability, restlessness, loss of interest in activities or hobbies once pleasurable, including sex fatigue and decreased energy, difficulty concentrating, remembering details and making decisions, insomnia, early morning wakefulness, or excessive sleeping, overeating, or appetite loss, thoughts of suicide attempts, persistent aches or pains, headaches, cramps or digestive problems that do not ease even with treatment. What causes depression? There is no single known cause of depression. Rather, it likely results from a combination of genetic, biochemical, environmental, and psychological factors. Research indicates that depressive illnesses are disorders of the brain. Brain imaging technologies, such as magnetic resonance imaging (MRI), have shown that the brains of people who have depression look different than those of people without depression. The parts of the brain responsible for regulating mood, thinking, sleep, appetite and behavior appear to function abnormally. In addition, important neurotransmitters, chemicals that brain cells use to communicate, appear to be out of balance. But these images do not reveal why the depression has occurred. Some types of depression tend to run in families, suggesting a genetic link. However, depression can occur in people without family histories of depression as well. Genetics research indicates that risk for depression results from the influence of multiple genes acting together with environmental or other factors. In addition, trauma, loss of a loved one, a difficult relationship, or any stressful situation may trigger a depressive episode. Subsequent depressive episodes may occur with or without an obvious trigger. How is depression detected and treated? Depression, even the most severe cases, is a highly treatable disorder. As with many illnesses, the earlier that treatment can begin, the more effective it is and the greater the likelihood that recurrence can be prevented. The first step to getting appropriate treatment is to visit a doctor. Certain medications, and some medical conditions such as viruses or a thyroid disorder, can cause the same symptoms as depression. A doctor can rule out these possibilities by conducting a physical examination, interview and lab tests. If the doctor can eliminate a medical condition as a cause, he or she should conduct a psychological evaluation or refer the patient to a mental health professional. The doctor or mental health professional will conduct a complete diagnostic evaluation. He or she should discuss any family history of depression, and get a complete history of symptoms, e.g., when they started, how long they have lasted, their severity, and whether they have occurred before and if so, how they were treated. He or she should also ask if the patient is using alcohol or drugs, and whether the patient is thinking about death or suicide. Once diagnosed, a person with depression can be treated with a number of methods. The most common treatments are medication and psychotherapy. What are the side effects of antidepressants? Antidepressants may cause mild and often temporary side effects in some people, but they are usually not long-term. However, any unusual reactions or side effects that interfere with normal functioning should be reported to a doctor immediately. Practicing positive thinking can help you feel better. Have you ever heard the saying that a glass can be half empty or half full? This shows how it is possible to think in different ways about the same thing. When you see a glass as half full, this is a positive thought. You are looking for good things about the situation. When you see the same glass as half empty, this is a negative thought. You are looking at the bad parts of the same situation. The same thing can be true of your life. If you look at your life and see only the bad parts, you are more likely to stay depressed. But if you can teach yourself to look for the good things in life, this often reduces depression. Even very bad things don't happen all the time. There are always parts of the day, or parts of your life that are going well. But when you are depressed, it is hard to see them, unless you look very closely. Seeing only the bad parts of your life and worrying about them can easily become a habit. This can help keep you depressed. But looking for the good parts can become a habit too, if you practice. This may help you get over depression. The same is true of thinking of the future. When you are depressed, the future looks bleak. But if you can practice thinking of good things you would like to happen in the future, you may feel less depressed. How can I help a friend or relative who is depressed? If you know someone who is depressed, it affects you too. The first and most important thing you can do to help a friend or relative who has depression is to help him or her get an appropriate diagnosis and treatment. You may need to make an appointment on behalf of your friend or relative and go with him or her to see the doctor. Encourage him or her to stay in treatment, or to seek different treatment if no improvement occurs after 6 to 8 weeks. Help a friend or relative. Offer emotional support, understanding, patience and encouragement. Engage your friend or relative in conversation, and listen carefully. Never disparage feelings your friend or relative expresses, but point out realities and offer hope. Never ignore comments about suicide, and report them to your friends or relatives' therapist or doctor. Invite your friend or relative out for walks, outings and other activities. Keep trying if he or she declines, but don't push him or her to take on too much too soon. Although diversions and company are needed, too many demands may increase feelings of failure. Remind your friend or relative that with time and treatment, the depression will lift. Finally, remember to subscribe to our channel and to like this video to encourage us to give you the best. And we waiting you for any questions or comments, or join our group https://www.facebook.com/psychologicalsolutions2020.